Hello, viewers. Welcome to Women Health Tips with Sarah. Today's topic is menopause. Before I go into the topic of the day, I would like to thank those of you that have subscribed to my channel. And also, I want to welcome those of you that have not yet subscribed. I will encourage you to do so. And please, when you subscribe to the channel, you also have to turn your notification button on. See, my aims are to bring health tips for women to your doorsteps at the comfort of your house. My aims are to help those women, no matter how little impact that I create. But I think one person, if I can change one person's health, that would mean a lot to me. So thank you and welcome to my channel. So today's topic is about menopause. Every one of us as a woman, no matter how little that individual is now, one day they're going to experience menopause. So I will encourage the young one to watch the video so they prepare their mind. And also for those women that are approaching menopause, so get you ready. For women that are already going through the menopause, just to have a better knowledge and be able to know and understand how to deal with it. It's a natural phenomenon, so it's gonna go away. And so, what is menopause? Menopause is a transitional period in women's life where women's menstrual flow begins to reduce. Before menopause begins, most women experience spotty menstrual cycle. Menopause begins 1 year after the final menstrual flow. Then a woman enters post-menopause. So, causes of menopause. Women bleed monthly due to the presence of egg housed by the ovaries. The function is to produce eggs, making estrogen and progesterone, which helps during pregnancy and all that, which control women's menstrual cycle and release eggs known as ovulation. The most uncomfortable feeling of menopause is one of them is what you see on the picture. The woman it's having hot flushes, and probably she has done all the fanning and all that, and it's not working. So she's decided to put a cold compress on her forehead just to heat the feelings and calm her down. So that's just the symptoms what happen when a woman is going through menopause. So causes of menopause. Menopause occurs due to cessation of egg production by the ovaries, leading to menstrual cycle cessation. So what that means is that when a woman ovaries stop producing egg, um, menstruation stop. There's no blood coming out anymore every month. So, and the symptoms of menopause, which I am going to mention, will start occurring. It is a regular part of aging, so there's nothing wrong. It is a way our body as women function. So it occurs after age 40 for the year of age. However, menopause differs from person to person. It doesn't mean when you turn 40, you're going to have your menopause. Some people can still have their regular menstrual flow up to age 50. It all depends on your gene and your background as a family history. So most women, sometimes some women, they have early menopause. It's okay, but all you have to always check it out in the with your doctor to see if it is real menopause or if something else going on. So it can occur due to surgical removal of the ovaries. So what are the causes? What happened that women decide to remove their ovaries? It could be so many reasons. Could be due to ovarian cancer. And when a woman have ovarian cancer, in order to stay alive, you can have to have no other option than to take off your ovaries. Also, hysterectomy. Hysterectomy is the removal of uterus. There are so many reasons why the uterus is removed surgically. Could be due to very big fibroid situated in the uterus and keeps growing and is unbearable. And the only way to keep the woman alive is to do hysterectomy or damage to ovaries due to chemotherapy. Some women that have cancer, no matter what type of cancer, sometimes when they are taking treatment, chemotherapy treatment, it can affect the ovary, can affect anywhere in the body. It all depends on reactions. So, in such cases, if the ovaries are damaged, the woman will automatically go into a menopause. So, what are the symptoms? Symptoms of menopause. Number one, symptoms most experienced with people, with a lot of women, is hot flashes. Hot flashes. This is a sudden feeling of a warm that radiate all over your upper body, making the individual feels blushing and sweaty. The flashes can be mild, moderate to severe. So sometimes if you're sitting next to people, women, and they start telling you they feel hurt, they ask questions, am I the only one hurt here? Just know something is going on and help that person to get some fan or some ventilation going on. Other causes of symptoms of menopause is vaginal dryness, sore breasts, frequent visit to the bathroom. Sometimes you go to the bathroom to you feel maybe you're gonna urinate and you don't nothing comes out. Difficulty falling asleep. This could be due to hot flushes. You may be very uncomfortable. You may feel the room is too hot, meanwhile the room is not hot. So emotional changes. Women go through emotional changes. One moment they're happy, one moment they're sad, one moment they are irritable. So these are the things that happen when they are approaching their menopause or when they are in their early stages of menopause. So another thing is dry skin. Your skin becomes drier, so please form a habit to moisturize your cream. Moisturize yourself every night before you go to bed, in the morning after shower. It is very important to moisturize your skin so that your skin can continue to maintain the nice texture. So your eyes may become irritable also. So sometimes you have to do annual visit to the doctor. You can have we have artificial tears in the pharmacy store. This could be over the counter, but first of all, please consult your primary care physician or your gynecologist. Dry mouth also is part of menopause symptoms, so you try to hydrate yourself all the time. Fatigue, fatigue is another symptoms that women experience. So if you experience fatigue consistently, please don't assume it's only the symptoms of menopause. You go see your doctor, because if a woman is anemic, they can have symptoms of fatigue, feeling fatigue, depression. For people that were not depressed all their life and all of a sudden they are overwhelmed with the symptoms of feeling depressed, you need to see a doctor and get support. Crankiness, you have to learn how to maintain your emotions, but these are all the symptoms of menopause. Racing heart, your heartbeat is going to go higher than expected. When that happens, you just take a deep breath and take it one day at a time. Headache is part of the symptoms that occur. Most women will have a lot of headache, joint and muscle aches and pains. It could be the pelvic can be painful, the muscle, the knees, all that areas, they're painful. Weight gain too. This is true. A lot of women um, have weight gain during menopause period. Hair loss. So changes in libido, which is another name for libido, is just not having interest in intimate relationship. Night sweat, sweat a lot. So we'll talk about the remedies for all this as we move on in the video. During menopause, when hormone level fluctuate, meaning it goes up and down, blood vessels expand and contract sporadically. which result into headache. So this is why women have headache when they are going through menopause. So as you can see in the picture, the woman to my left, she's having knee pain. It's part of the joint in the body that's due to menopause. As you could see on at the bottom of the video, you see here, this woman is has no interest in what is going on in her life, so in the world, due to symptoms of depression. How long does menopause symptoms last? So it lasts for 4 years maximum, but again, it depends on your family history. It could last for 1 year, 2 years, three, and at least four. So it depends. So, what are the things that we can do to actually confirm if a woman is or has going through menopause? So follicle stimulating hormones. These are tests that is being done. Follicle stimulating hormones are hormones that helps the release of egg from the ovaries. When it is time for ovulation, these follicle stimulating hormones they are increased in numbers, but when it's excessively increased in women, and then those also the woman experience irregular menstrual cycle, it might be an indication that the woman is going through menopause. Estradiol tests indicate how much estrogen the ovaries are producing. So those are the tests. Another thing that we can do to make sure that it's not menopause, just is what we call thyroid hormone tests. People that have thyroid problem may have same symptoms that mimic menopause. So it is always advisable. Please visit your doctor to make sure you have the correct diagnosis, because there's nothing as bad as treating something else where you're not having those problems, not knowing that it is something else. So always seek medical advice for everything concerning your health. We have one body, we need to take care of it. Anti-malarial hormones are done to know the reserve eggs in the ovaries. So these are all the tests that needs to be done to confirm if the woman is actually experiencing menopause. So, what is the treatment for menopause? Menopause is a natural phenomenon, so the symptoms will go with time. However, if individual is unable to bear those symptoms, so you can now seek doctor advice. So when you seek doctor advice, remember I said you have to confirm at least if you are experiencing menopause. And how do you do that? Is by keeping records of your menstrual flow, how the frequency of the menstrual flow, and how they come. Is it every 2 months? Then you see, is it monthly? Or so you need to keep record of your menstrual cycle these days with a lot of people having cell phone have a calendar. So when any woman that is going through menopause, please, I will encourage you to use your cell phone so that when you see your period today, you put the dates, and the next time when your period comes again, you put the date so that by the time you visit your doctor and you are in the doctor's office, you don't have to crack your brain to remember when you saw your last period. All you do is just check your phone and see the record that you have. So that's my little advice to you. If the symptoms are causing unbearable feelings for you, that you cannot handle it, it's time to seek your gynecologist advice or your women's health nurse practitioner for symptomatic treatment. So there is no particular treatment for menopause. But if symptoms are unbearable, so the doctor or the nurse practitioner can manage your symptoms based on what is going on in your body. So hormonal replacement therapy is something that most doctors remain recommend for women to do. So what that is, it's just an artificial hormones, the estrogen and progesterone, because your ovaries are not producing them, so it can be replaced artificially. So it's individualized choice. So if you think that's what you need, you go for it, but that has to be done under supervision or prescription of a doctor. Topical hormones therapy that contain estrogen cream. This cream is inserted for into the vagina to ease the dryness. This is for women that experience excessive vaginal dryness, so they can use estrogen cream therapy. Non-hormonal medication that is used to help with menopause is Paxil. Paxil is anti-depression medication, so it's not taken without a doctor prescription. So if that is prescribed for you, you have to take it carefully and follow the instructions. So it was this medication Paxil has been approved by FDA. Food Drugs and Administration has approved this medication to treat hot flushes. And another medication that can be used to treat hot flushes is gabapentin. Another name for that medication is Neurontin. And clonidine also can also help with hot flushes. Please, these medications are prescribed medication, so please do not go to your doctor office. It's a warning, or to the pharmacy and get it. Um, I know because the reason why I'm saying this, there are other people in other part of the world that not necessarily will need prescription for gabapentin or clonidine. They just go to the pharmacy store and request for that. Please, you need to consult with your doctor first before you use it. Do not say that, oh, um, I saw it on YouTube, so I decided to buy it. So always seek your doctor advice before you take any medication. And the reason why I'm giving you the name is just for you to have an idea. And also, one thing I would like to encourage women and everybody out there, please, especially in developing country, when you have medication or being treated for any kind of health problem, please do ask the doctor what you are taking. Is your body? You are taking the medication. You need to know. You have the right to know what you're taking into your body. The reason why I'm saying this as a healthcare worker, sometimes you have family members, friends, or relative that when you call them, they tell you they are not feeling well. Then when you ask them, what did they see the doctor? They say, yes, of course they have gone to see the doctor. But the problem is when you ask what medication you are taking, I don't know. I don't know. That's really it's not a good practice, please. No offense. I'm just saying based on my experience and what I have experienced so far. So always ask what you are being given. It's good to know. It's not going to make you a doctor. It's just that you have to know what you're taking. Okay. So other treatment that might be good is very necessary is vitamin D. I know we get vitamin D from the sun, but at that age, when you're approaching 40, 50, you need to take extra vitamin D once a day to help you with your bone development and to keep your bones strong and healthy. So most of this treatment can cause heart disease and breast cancer. So if you choose to take treatment, consider the lowest dosage for a short period. Remember, all medication, including Tylenol, it gives side effects. So you'll have to weigh your options. If I take medication that will cause cancer for me, does it worth it? Is an option that you need to. If I take medication that will cause heart block, can I bear the symptoms of menopause that is going to go away within 4 years, within 1 year, or do I take medication that will cause blockage in the artery? So those are options that you need to weigh. So, what are the remedies that you can do to minimize the feeling or the symptoms of menopause? So, the drinking cold water a lot, if you can handle it, is very good. You have to drink cold water. sleep in a more relaxed environment with air condition on or fan. And if it's not possible for the use of fan and air condition, depending on your geography, so you can leave your window open at night anytime you are in your house, or in the evening if you have opportunity to sit down sometimes outside to get your body cooler, some fresh air that's possible. Or I would advise you at least take shower right before you go to bed so that you'll be able to have some sleep. Use of over-the-counter vaginal moisturizer is advisable if a woman is having excessive dryness. Exercise regularly to sleep better. So when you exercise toward the evening before you go to bed, that can help. So do Kegel exercise to strengthen the pelvic muscle. Doing Kegel exercise, it helps to control the bladder, so to prevent bladder leakage. So maintain social contact mentally keep you stable emotionally, and your memory keeps the memory going. So do not let all the symptoms that you have deprive you from living a normal life. Avoid smoking. Smoking, it causes early menopause and increased hot flashes. So for those people that smokes, I think at this age it's time to cut it down due to other health issue that it might bring to you. Reduce alcohol intake for people that takes alcohol a lot. So reduce it. Eat a healthy diet and maintain a good weight. Healthy diet. I don't know what some people consider healthy diet, but for me, all diet food are good for the body. What makes the difference is the quantity that you eat. So it portion control. We need carbohydrate in the body. We need proteins. We need vitamins. Everything taken in excess is what causes problem. It is not the food itself. It's how much the individual consume. That's what makes the difference. So practice yoga, deep breathing exercise, massage. If you don't have money to go to the massage store, you can ask a family member. It could be your husband, your spouse, could be your son, could be anybody at home. Just a little bit massage in the body can help. So, what are the things that happen to us as women as we go through menopause? This is complication. It has complication. Bone loss. Most women do experience pains in the joints, pain on the pelvic area, the bone um, develop some problem. Heart disease can occur also. Weak bladder, that's why there's leakage during that time. So that's why the Gego exercise is encouraged to strengthen the pelvic muscle. Irregular bowel movement can also irregular bowel. So individual, you've naturally in the past you used to have your bowel movement maybe daily or twice a day, depending on your food content. It might be irregular, meaning you might be having constipation. So it's very important to keep up eat fiber diet and also drink a lot of fluid, not in excess. You don't want to do circulatory overload. Just drink enough to keep you going. And at night too, you don't want to drink when it's 9 p.m. I will advise the last drink for the day for menopausal women that may have problem with bladder to drink water at least up to 7 p.m. so that by the time you are awake up till 10, you might have been you might have used the bathroom twice. So menopause also causes predisposed people to having Alzheimer's disease. It might not be everybody, but this is something that may occur. So if you have an older woman in the house and they are having forgetfulness, please bear with them and encourage them and be patient with them because we will be in that position sooner or later. Wrinkles are something that occur when a woman is experiencing menopause. So you need to moisturize your skin. Go to the store for those that can afford some moisturizer for their faces. Use it every night. Wash your face with warm water and apply moisturizer. Poor muscle tones. These are complications of menopause. Poor vision. Some people may have cataracts. Cataracts is a clouding of the lens of the eye. Also, another problem would be macular degeneration, breakdown of the tiny spot in the center of the retina. That is the center of vision. So, with this, what do you do? In developed country, there is what we call annual visit. And even with that, it's not everybody that keep up with it. In developing country, annual visit to the doctor, some people might know about it, but they don't really do it. Um, there are so many factors to that. I understand. But to encourage people, I would like to advocate for you saving your money every month. Keep something away because I know, oh, annual visit that will cost a lot of money. That's what we go through. Some people mind when they hear this, but it's better to save money and keep, and you go to the doctor once in a while. I believe in preventive medicine because there's no really, if I'm wrong, I am not above mistakes, but you could correct me. There is no cure for any illness except it's a bacteria. Bacteria has a cure. You take antibiotics and the infection is gone. Every other illness does not. Illnesses that we have, there's no cure. We are doing control, preventive. We just control, we don't prevent. So, in order for you not to get any chronic problem, you prevent it from happening. So, please, I encourage people to go to annual visit, and most of the time, people suddenly either sick or died, and then the story goes, "Oh, were they sick? How could they just sick and not they've been sick? They didn't know because they never go to the doctor office to check out. They keep postponing. They keep praying. Listen, I'm not against praying. I'm a Christian woman, but faith without work is like you pray to God to give you a job, and you just sit down at home and you think that job will come from heaven, or you're hungry and you say, God, give me food. You're not you have things at home that can become food, but you don't get up to do it. It's not going to become food until you get up and act, basically start the process from the beginning to the end before it becomes a meal. So I encourage everyone to visit doctor's office annually and get yourself checked out. If there's nothing wrong with you, you thank God. And if something wrong, you ask, what can I do to fix it? Okay, thank you so much for watching. Please, I encourage you to subscribe to my channel. And if you do have any topic that you want me to address, I will be able to do that. Thank you. God bless you. And please take care of yourself. Bye.